I'm Dr. Cassie from NAVC's Vetfolio and the host of Vet2Vet. A huge part of what we do as veterinarians is human-to-human communication. And when you're talking to a human about an animal for which they care quite a lot, and about finances and tough treatments and food and congenital conditions, it can get a little overwhelming for everyone. What if there was a tool that could help doctors and owners get on the same page? Today, we're talking to Dr. Jules Benson. He's an expert in strategies for care and communication. Dr. Benson is a graduate of the University of Liverpool School of Veterinary Medicine. He's been active in conservation efforts in Africa, and he worked in clinical practice before moving into the pet health industry as a thought leader. Dr. Benson, thank you so much for joining me today.
It's good to see you, Cassie.
You too. I always have fun with these conversations. We know a lot of pet owners kind of like to do their own internet research before a vet visit or sometimes even during a vet visit. And Nationwide is kind of leaning into that. So can we talk about in terms of the Pet HealthZone? What is the Pet HealthZone?
So the Pet HealthZone is a digital platform. So the thought came to us around, if exactly as you said, if someone's sitting in the exam room, to me, and having worked in the industry on the pharmaceutical side and the nutrition side, like it's so hard to get that information into people's hands, and it has to be engaging. It can't be educational. Like I think the education word can be a tough one, right? It has to delight them. It has to be engaging. And so for us, really the goal was, how do we use our extensive data, put that in front of a family, a pet family, and a veterinary healthcare team, and help them tell a story about their pet, help them understand the risks, help them display or see the data in a meaningful way that matters to them. So the Pet HealthZone is this digital platform that takes all of these aspects, rolls it together, and makes it super accessible, allows people to see what not just the pet health risks are for their breed and their life stage, but also loads of fun stuff as well. Like, what are the most popular names for that breed? What are the things that you should be looking at in terms of grooming and training? So all kinds of things, again, trying to make it fun and trying to make it something that isn't just eating your vegetables. It has to be something there's a little bit of a sweetness there as well.
Yeah, that makes a lot of sense. I love the word that you use there, delight them, because I mean, that's how I would want to feel if I was doing research about my own pet, of like, is this true? Is this not true? What do I really need to worry about? Yeah. And if it was information that came across as really personalized to my own pet story and some of the unique things that I can relate to and I've experienced with my pet, yeah. I think I'd be much more likely to be delighted and engaged.
Good. Yeah, no, it's and the experience so far has been great. And I think we've talked to a lot of veterinary healthcare team members. And I think, going back to what you said earlier about lifting some of those burdens, not just the educational burdens, but taking the heavy lifting out of some of those conversations that we have in the clinic.
Absolutely. Yes. And so let's get into some of those heavy lifting type of conversations, because those can be tough, especially if, maybe we have a breed that's prone to a number of different things that we're concerned about. What types of health information are available on the Pet HealthZone, and where does that information come from?
So the what's in there at the moment is basically the top 3 disease risks per breed, per life stage. So you can imagine across the life of and these come from the AHA guidelines, the life stage guidelines. So we're using really good scientific basis for this, because we know that a mature adult bulldog is going to be different ages from a mature adult Jack Russell, right? Like the lived experience is different for those breeds. And so, the data in there are really, what are the things that are likely to happen based on our data? And we're using over 5 million years of pet health data. And to me, I think when I was in practice, and I wonder how it is for you, like so much of what I do is informed on my personal experience. And that's fine if you're looking at a lab or looking at a Yorkie or something where we see a lot of them. How many Havanese do you have in the practice? How many do you see?
I mean, I could probably name the Havanese that I've seen. Like, I probably remember all of their names because there's not, 50 of them.
Yeah. So the Pet HealthZone uses data from about 30,000 years of Havanese dogs. So that's, if you saw a Havanese for an average of 8 years, you'd have to see 4,000 dogs to get the same amount of data that's represented in the Pet HealthZone. So so to me, like as a data nerd and as a veterinarian, that excites me to say, like, well, what don't I know? And the data that we have on breeds really comes from like fairly thready sources. Sometimes you look at the data If you're looking at pancreatitis risk, like the textbooks are using data from a study of 300 something dogs seen at one teaching hospital 20 years ago, right? So this to me is a quantum leap forward in how we're using data to look at what the specific risks are per breed.
That's really exciting to think about having that much data compiled, because you're right. I'm thinking of a Cavalier that I saw, and the owner said, "What
Yeah.
are they prone to?" And I kind of had to dig deep because I knew there were several things. And I went, man, it's
Yeah.
been a while since I've thought
Yeah.
about this.
Yeah.
When we talk about these thousands of years worth of data,
Yeah.
is that, again, coming out of some of this AHA database information? Where exactly are we compiling that data from?
It's a great question. So nationwide, we insure 1.2 million pets at the moment, right? So going back in time, that's 20,000 or 20 million years of pet data I think we have over the last 40 years. So we're using some of the more current data because that makes more sense, right? Because things change over time. But it's from our claims. So we receive over 3 million claims per year. So the ability for us to take those claims data and the biggest difference that we have versus your practice data is that when we receive a claim, we want to know what it's for. So we say that's pancreatitis, that's bladder stones. And that's not something that kind of labeling is not something we have in our data generally. So really the insurance side is the most powerful place that we can start to collate those data and make them into meaningful outcomes that actually mean something to veterinary healthcare teams and pet families.
Absolutely. That makes a lot of sense that, that's where the problems are ending up. So then we can kind of find
Yeah.
out what really is happening in our patients.
Yeah.
So when we think about using this in the veterinary clinic, I know, we talked in the beginning there about sometimes these owners are doing their internet searches in the exam room or, in between us coming in and talking to them. How do we foresee implementing the use of the Pet Health Zone in veterinary clinics and in the exam room with our clients?
Yeah, that's a great question. So people can go to the petinsurance.com website and request materials for the Pet Health Zone. And to me, the value really is in if they're sitting there, playing Candy Crush or scrolling Facebook or whatever the things we do when we're somewhere with time to burn. Is Candy Crush still a thing? I don't know. I may be aging myself in apps now. But to me, like having them, see a piece of material that says, do you want to know more about your pet? And from a veterinary healthcare team point of view, feeling the confidence to put that up because the data come from somewhere meaningful. It's not just a Google search. Having that data going into the exam room, because we know we want to have conversations with them. We don't necessarily want to talk about the things they found on Google or the things they heard from their friend at the supermarket. We want them to have high quality, education. And so I always think back to some of the hardest conversations I've had. Like I remember a Rottweiler who, 7-year-old Rottweiler, not eating, not doing great. What we know as clinicians that we're probably looking at a cancer dog there, and it was a splenic hemangiosarcoma. But them having the ability to look at their dog and see, yes, your breed is a high risk for cancerous diseases, and then going into the exam room, I think that would have eased the conversation for me considerably because they were super upset, as they should be. But I think just easing some of the blows around, and you talked about cavies, like just having a cavie owner, a healthy cavie, in the exam room, and then being able to scroll forward and see what are the things that are going to happen to my cavie, and knowing that mitral valve disease is one of those, being more ready for the conversations around imaging, more ready for the conversations around home monitoring for resting respiratory rate, being more ready for treating in those silent stages where we're going to get the benefit of drugs like pimabendin. So to me, this all makes things easier for us.
And I couldn't agree more. That actually kind of feeds into my next question about the benefits to pet owners. But absolutely, I'm picturing a benefit to the owner, to us, as you said, and to our patient, because if you're looking at this information and you say, yes, this breed, in the Rottweiler example, I had a Rottweiler for a long time, and yes, ultimately cancer got him. But if they were to look at it and say, okay, my breed is prone to X, Y, and Z disease, it makes it easier for them to wrap their head around it if we do end up with that diagnosis, but also maybe more apt to bring the pet in if they start to notice something funny, because they can say, well, 100%. I know they're prone to this, so could there be something going on here?
Well, and so Rottweilers, being, as 10 times more likely to have had a claim for osteosarcoma than other breeds. like that to me changes the conversation we can have in the exam room, saying, hey, if your senior Rottweiler is limping, let's not wait on that. Just because we have this information, we know that hopefully it's nothing, but knowing that we can catch these things early and we stand a greater chance of treating. And that's the other thing that's in there, right? So there's two other pieces of information. Well, there's lots more information, but two other key pieces of information is how much could it cost? And so we have in there at the moment, what are the first 30 days of cost look like from a claims point of view? And then there's some stuff in there about what can you expect of the vet? What could you do to prevent? And what does this look like, long term? Like what is the outcome? So I think, again, cancer's a tough one because obviously we can't always predict, and there's not necessarily things we can do around prevention. But orthopedic disease, that stimulates a conversation about healthy weight, about proper exercise, like about using omega-3s. Like I think having some of those abilities to be proactive in that conversation, our goal is for Pet HealthZone to start fueling that as well.
There's so much to talk about in these exams, especially when we're talking about, these comprehensive annuals where are we talking about nutrition? Are we talking about weight? Are we talking about what vaccines you've had? What prevention are you on? And on and on and on, if there's skin conditions and all of this. So if the owner can kind of come in already prepared with some of that information, that can really facilitate that conversation. And also, you mentioned knowing around how much it costs and what sort of diagnostics to expect.
Yeah.
If people have that information and there's not quite the sticker shock there,
Exactly.
that I think could be just facilitate that conversation from all sides, and prepare people from the get-go to say, for the conditions that my dog is prone to by breed, how am I going to handle this financially so it doesn't become a crisis in the moment if we can avoid that?
100%. And financially, emotionally, just fitting into that. Like, again, going back to that Havanese, like, so we know that Havanese, based on the data, are four times more likely to get bladder stones in their later life stages.
Had no idea.
Right. They're 5 times more likely to get valvular disease, which we could have guessed maybe from small dog diseases. But like these data being in there, like it to me, it allows us to have much more constructive conversations about all of those things.
Yeah, and from the veterinary standpoint too, I would not know to advise a Havanese owner about bladder stones, but
exactly.
having that information to say, okay, if they are prone to this, then let's talk about what that would look like.
Yeah.
Very cool, very cool. I think we've already spoken to this a little bit, but benefits to the veterinary team. Certainly easier conversations with owners. What are some of the other benefits we can look for to the veterinary team?
Well, at the time, honestly, we're all strapped for time at the moment, and veterinary healthcare teams, just knowing our workforce crisis at the moment, and it feels like things might be easing off a little bit in terms of people being jammed up on their schedules, and we may be returning to more COVID levels, but still, we want to be more efficient, we want to be more productive, we want to give our patients, and our clients higher quality care, and I think this is a way to do that. So just trying to preempt those conversations. And you talked earlier about the exam room's a great place to do it, or the waiting room's a great place to do it. You can also send out a link beforehand. We can also have, training for our teams in the hospital as well, like, of the common breeds that we're seeing. Let's check out Pet HealthZone and just make sure we know what the things are coming up. If we're seeing a less common breed like Havanese, what are the things that we should be talking about? So I think, again, just trying to increase the efficiency of our teams, this to me is a tool that should do that for us. Then there's the aspect of the tough conversations. Anytime you're talking about a disease process that's going to be challenging and or costly, frankly, right? So, and as we look at, and heart disease in cavies is a great one because it's got a long tail. We know this is a chronic disease. We know that we're going to be treating this dog for a long time. And so having those conversations up front, and then you already touched on it, the sticker shock, being able to say, these are some, and what we use at the moment is the 80th percentile. So if the 50th percentile is the average, we go a little bit higher and say this is there's a greater than a roll in the dice chance of it costing this much. So let's start a little bit higher so that people are more prepared for some of those conversations about what things could cost. So I think from 3 of those aspects, like our goal is for it to help veterinary healthcare teams.
I can absolutely see it from all of those standpoints. And another thing that just popped into my head, going back to your example of the Rottweiler, I think is a good one. That's a shocking diagnosis in a 7-year-old dog if you're not prepared for it. Absolutely. And like you said, the owners were really upset. Sometimes we can get a lot of displaced emotion that's directed towards the veterinary healthcare team. They're upset that their dog is sick. If there's finance, If there's financial concerns, then those are a big source of owners being upset and displacing their emotions on the veterinary team. So maybe if we can let them get upset before they come see us and get those emotions out, and we don't necessarily have to be the boogeyman coming in and saying, hey, there's this really, either serious or costly or both condition that we need to work up. Having an owner already be able to process some of that emotion, I think, can create just maybe stronger bonds between owners and the veterinary team, and just everybody can have a little bit better day because maybe we'll see a little bit less displaced emotion.
Yeah, and honestly, that's why it sticks in my head, because the husband was angry, and he was angry at me for giving the news, and so exactly to your point, displaced emotion, and I understand it, and it was natural, but it was it was shocking at the time, because like you feel you're in this caretaker position of giving this terrible news. But at the same time, as you said, like if there's an objective source that's saying this is a thing that could happen, and it does happen, then perhaps it feels like we're more of a team-based approach than something that's confrontational, adversarial.
Absolutely. And even though you understood that anger was natural, that emotion was natural, I mean, it still makes your day a little worse.
100%. Yeah. Well, and I still remember it. I mean, 15
Right.
years later. Yeah.
Absolutely. Absolutely. Well, Dr. Benson, this sounds really exciting. I'm really excited to dig into it a little bit more and learn more about the Pet Health Zone. And it sounds like it can be a huge benefit to our clients, to our patients, to us as veterinary professionals. So thank you so much for joining me to have this conversation. Any final thoughts you want to share with us?
One of the questions we get asked a lot is, how much does it cost? And it doesn't cost anything. So like, I think that's the shocking thing of like, so it doesn't cost anything. And obviously, one of the ways that we want to use this is we do want to encourage people, obviously, that we think that pet health insurance is a great way of getting ahead of those risks. So, obviously, coming from Nationwide, this makes a lot of sense for us to say there are risks out there for these breeds. Let's make sure that we have some options on the financial side when it comes to it.
Absolutely. Absolutely. Well, thank you again for such an awesome conversation. It's always great to talk to you.
Awesome. Thanks, Cassie.
And thank you to Nationwide for partnering with us for this edition of Vet2Vet. Check out navcsvetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.